Hello and welcome to Health and Wellness, your guide to the integrated personal and financial retirement journey for physicians. I'm your host, Michael Swartz, Certified Financial Planner and Master Certified Physician Development Coach. All right, welcome back to the Health and Wellness Podcast. I'm Michael Swartz with Joanna Tan, retired family medicine physician in Yorba Linda, California. In our last conversation, we talked about the career path and leading up to the final year of her practicing medicine, I guess, but you've never really stopped being a doctor, Joanna. You've made that very clear, even into retirement. And so, to remind the listeners, you spent 42 years at a practice in Yorba Linda, and about 4 years before you retired, started putting some things into motion. And I think for a lot of physicians who are looking ahead at retirement, that's going to be a powerful wake-up call. And so you mentioned promoting some staff, paring down some of your professional responsibilities. And then in that last year, starting to tell patients when you come back for your annual physical next year, you'll be with another doctor, but actually being intentional about who they would be working with, kind of creating your own transition plan. And so if you can pick up there, kind of where we left off in our last conversation, what did that last year of your career really look like?
Wow, that's a very powerful question. Very powerful. It was, you know, just like I alluded to the first session, I love medicine. I love being a doctor. Um, is my calling, is my life. And just like what I said before, I think I was born a doctor. My calling was being a doctor. I will be a doctor until I die. That's the way I see it. So, but yet as far as clinical medicine is concerned, I think being a doctor is more than just, practicing medicine in a clinical practice setting. Um, I think that I was a doctor because I was the first lady doctor in the community. I was a doctor even when I was outside my office. I doctored the soccer team players. I doctored the high school students. When I was visiting them. I doctored the orchestra when they were on trips. I doctored the science Olympiad team when they were on national competitions. I doctored people in my office and outside my office, and I'm totally good with that. Totally good with that. Um, but after 42 years of relationship with my patients, it was not easy. It was not easy. I did a lot of soul searching and go, is this what I want to do? But yet in the meantime, I thought, the practice of medicine has changed. And I cannot say that, it was easy because it was difficult, the electronic medical record and all the regulation that we have to do that we didn't have to do years past. Practicing medicine was complicated. And but yet I thought, and I'm not saying that I did not go through burnout like doctors, because I did. I was burned out about 10 years before I retired. And that was around the time, I didn't know what burnout was, but I was. Um, and at that time, my husband and I have always been a good steward of our finances. We were not big spenders, but we spend when you think that is, we spend, we give, we donate, we did what we feel that we should be doing with our money, but we also invest and save. And so we were in very solid financial ground. And, if I were to retire in my 50 or my 60 or 70, doesn't matter. So finance has never come in the formulary as to when we can retire. But I thought, being a physician, I need to be mindful of my intellectual ability to be a good doctor and whether physically I'm able to do a good job. So I thought 70 is a good time for me personally. And so that's how I set the stage for retirement. The year before, it was difficult because I know that after I leave, I can never get into these patients' record anymore. I can't write prescription for them anymore. If there's an issue, I cannot do X-ray for them anymore. It's tough. It's very tough. But yet, that's how it goes. Because I wanted to leave at the peak instead of um, sunset. Oh my gosh, time for her to go. She's not really doing a good job. No, I don't ever want that to happen to me. I want my patient to remember me like if Dr. Tan is here, she would have known exactly what to do with this issue. She would have known exactly what to do. I want to leave like that. So so a year before I retired, I start making that plan. I let my patient know that I'll be leaving and I make sure that and of course, they've been with me for so many years. They go, "Oh, what am I going to do?" Well, I know my colleague very well. I know who has opening. I match my patient with the physician that I think best serve them in their medical need as well as their emotional needs. So every single one of my patients, pretty much, I match them with the physician that I think is best for them. So there was just, I think it was good. Um, every day though, over the last year, there was just tears, patients crying. And in fact, after I left, I still go back to the office, and the staff said, "Oh yeah, Mrs. So and so was here. They're they're still crying in the waiting room." It's really anyway. About 6 months, 7 months before my retirement, a group of my patients decided that I deserved to have a party. So they formed a retirement committee and planned a retirement party for me. And I thought, oh, that's cool. That's nice. So on the day of the party, I had over 400 patients showed up. It's a weekday. It's a weekday. And and the room that we had there probably was more because they couldn't get into the room. I think I have a number of people go, I came, there was no space. We were outside, so we just left a card and um and we left. So that's what happened. And but what was really heartwarming is that it's a story that they share. I see one of my patient, he said, well, how many people, raise your hand, how many people are still alive today and doing well because of this woman? So many people raised their hand. And I thought, really? And people would tell, they would in public, they share their story. Oh yeah, she found my cancer, she found my breast cancer. Oh yes, yeah, she was so good with that test. And if not for her, I would not be alive today because she found my cancer early. And oh yes, I was in the hospital and she was there. She came and visited me the following day when I was just getting up in pain and she was there with me. And I thought I was only doing my job. So only doing my job. But yet all these people thought that I was doing my job and that every single one of them thought that I guess I gave them special treatment because they're all very special to me. Every single one of them. And it was phenomenal. It was just a phenomenal party. And then 2 weeks later, I had another party from the staff and the doctors in the group, and some more tears. And people were just going up to the podium and said, "Oh yeah, she had done so much for me, and and whenever I work in the office, she taught me so much." And I had one staff member. She said, "I wouldn't be here today, um, if not for her." Because when they transferred me to her office, I thought because I was known to be a tough cookie. If I call out if there's something not right, I will call it out. And she thought I went over there and I thought she was going to write me up and I'm going to lose my job. And instead, she said, She was there. She taught me, gave me the opportunity to excel. And in fact, right now, she not only did she not lose the job, she is a lead back office assistant. So it was good. It was very good. Um, like I said, about 10 years ago, I went through burnout, and I thought I can leave medicine. I was ready. I can leave medicine financially if I want to. But then I thought, if for somebody who loved medicine so much and be burned out, what happened to my colleagues? They're all suffering in silence. And I thought, no, I'm not going to leave medicine. I'm going to do something about it. So in my naivety, I thought I can do something about it then. So I started a physician and provider wellness committee about 10 years ago in our organization. And it was tough. I thought I can fix it. I thought I know exactly what's causing burnout. You know, I can we can go ahead and work and make our workplace more efficient. We'll see whether we can fix the EMR so that it would be more physician friendly. Um, you know, regulation and all that. The staff can help us out with that. Hey, let's work together as a group and see what we can do about it. It just didn't work. It's like an elephant in the room, and and the system is tough to fix, very tough to fix, and it was hard. And so, quote unquote, during retirement, I still chair the committee because in the wellness space, I was very fortunate that I had a lot of experiences at the state level, at the county level, as well as an organizational level. So I can put things together to make things work. So since retirement, I still chair the committee, and I'm at this point in time, um, our, you know, our wellness effort is going into the personal space of the physicians. Um, and certainly we have done a lot in the workspace in terms of workplace efficiencies and how to, give decrease the pajama time that the physician has to spend outside of work, helping them to get time away from work. And while they're away, finding them, coverage for all the in basket and lab and all that they have to do. Those were good. Pharmacy refills and all those were very good initiatives that we put forth in the organization that help our physicians with their burdens um, in their office work. But the last year and a half since retirement, because of my experience with retirement, I thought, well, let's go ahead and go into the personal space and get them planned for retirement. So we thought, oh, let's go ahead and do a retirement readiness program. So we put that program out, and I thought, oh well, maybe the physician in their 50s and 60s would like to come. Oh my gosh, we had standing room only. And we had physician in the 30s and 40s. They were there. I thought, oh, geez, this is interesting. So then I thought, well, let's do another retirement readiness program on financial planning. So we put that out, and we had over 100 doctors that came. Can, I mean, how could you it's just amazing, that after a long day, and they came to the program, and I thought, whoa, this is so. I think that this is an area that is needed that has not been addressed in our organization. Um, so going into the personal space of this physician just outside of the workspace. Um, so since retirement in the last 18 years, I've been busy. I I don't think I'm retired. I might be retired from clinical medicine, but yet I'm still working for free. And there's something so liberating about that I am working for free and you know, that I have the freedom of saying, hey, I want to come to this meeting. No, I don't want to come to this meeting. but yet every day, like I had two meetings yesterday, two meetings yesterday. And there are times when I have three meetings the whole day, one in the morning, one at night, one in the afternoon. It was fun staying connected. And then what was really cool also is that I was able to work with some of the retired physicians and bring them back into the fold because they have so much experience in their lifetime. It's such a waste for them not to share it. And so, many of the retired doctors that we have in our community, they're busy.
Hmm.
Get down to their schedule. They're busy. I mean, they are not lacking of anything to do. I mean, they're always out traveling, playing with their grandkids, doing this and doing that, fixing up their house. To get them on my schedule is really hard, right? Really, really hard. But I was able to bring some of the retired physicians, back into the fold so they can share their experiences with the physician in the group who are still practicing. So that was good. This next program, we are working on a program in next month um, on family wellness. So we're doing a session on parenting and keeping your love life in sparkle while you're still taking care of children and working, marriages and lifestyle cooking. So we have cooking demonstration. We have another one coming up. So yeah, the last 18 months has been very busy and I've been traveling like crazy. Oh, before we end, this is something that I think your audience need to know. If there's something that you want to do, don't wait until you're retired. Do it. Just do it. Don't wait. Like my husband and I, we have a heart for the underprivileged. So we have done a lot of mission trips. And a lot of physicians go, oh, when I retire, I'll go on mission trip. Do it when you're well. Do it when you're active, doing when you are still healthy, because that way if you get sick in some of these country and serving there, you may not make it home. And also, when you're still actively practicing, you're at the top of your game, so you can bring the best medicine to these communities. So we have led dozens of mission team, to foreign countries to do missionary work. And then the other thing is that my husband and I love traveling. We did not, we traveled all our life. Ever since we got married, we traveled. We did not wait. People go, oh, when I retired, um, I'm gonna travel here and there. I'm gonna do my bucket list. No, we start working on our bucket list when we came out from practice. And we have been to all seven continents, visited close to, if not more than 60 countries, loved all the experiences. Um, do it while you can, and you can make that happen. Don't wait. Do not wait. Yeah.
Well, I think that to kind of recap real quickly, it really is a testament to the practice that you built, but also the intentionality that you brought to the entire arc of your career, even into retirement. Joanna, that you've seen these massive celebrations, both from the staff and patients, showing up to celebrate you and your role as a physician, and even into retirement, almost taking some really good wisdom that waiting till retirement may not be the best choice. What if we pulled that back into our career and did a lot of the traveling kind of throughout, rather than trying to see them as two distinct periods? Integration, even between retirement and the career, and really making it a full, and you mentioned balance, a balanced life of experiences, both for the patients and for yourself and your family. And it seems you've really done that intentionally and by design. And so, as we teased in that first conversation and introduction, you're also going to be putting a pretty big check mark on one of your life goals. And I'm really excited to have you come visit Wisconsin and stay in La Crosse, and maybe to share kind of that exclamation point that you're putting on one of your big goals in life. And so you had a goal of, I believe, visiting all 50 states, if I'm not mistaken.
Oh, yes.
And so,
That is my bucket list. I got to visit. So we have three more states, Wisconsin, Minnesota, and North Dakota. And after doing that, we would have gone to all 50 US states. I'm just so excited and checking that off of my bucket list. And then I have to create some more bucket lists. The
what a
bucket list is
great,
not going to finish. We're going to have to create more. Yeah.
what, I
And
mean,
and
what
what
a,
is really cool, for our audience also is that is relationship with family. So we're bringing our two grandchildren to visit you. Go
and that's,
fishing,
yeah, and to do some
Mississippi.
fishing and
Yes.
you'll do some
Yeah.
hiking and get to see the
Yeah.
driftless region here in Wisconsin. And yeah, I think that the testament that you've always had, that it's a testament to your family, to your relationships in general, that you show up, you give your best, you do your best, and continue to give back and bring on not just your children, but even that next generation of grandchildren to share in those experiences and those life journeys. And so, um, with that, any closing thoughts here that listeners need to be aware of as they start thinking about their own retirement and career trajectory?
I think retirement is a stage in life. Um, for me, retirement really does not exist.
Mhm.
We go through different stages in life, and just to make the very best of every single stage in life that you can with intentionality and enjoy it and enjoy it more. Just enjoy every single day as though it's your last.
That's wonderful advice. So thank you, Joanna. Thanks for talking about your early career, your work as family medicine practitioner, the entire arc of your career, the planning that you did about your retirement, and now kind of letting everyone know it's not the end. It's just a milestone along the path of life. And really knowing who you are and integrating every facet of your life, every domain into how you show up is a very seamless transition into that next period, not necessarily a finite portion of career and then this brand new beginning in retirement, maybe a bit of more of a continuation of who you are and how you show up in the world. So thank you.
Yeah, that is great. Very good summary. Thank you so much, Michael.
Well, thank you for your contribution and being willing to share your story, Joanna.
It's a pleasure.
Take care.
Thank you.
Thank you for listening to this week's episode of the Health and Wellness Podcast. As always, I'm your host, Michael Swartz, Certified Financial Planner and Master Certified Physician Development Coach. If you're looking for additional resources for integrated physician retirement planning, please visit healthandwellness.com. We'll see you in the next episode.